share screen. And we should be good to go. Yeah. Okay. So chapters here, there were 2 chapters in this one, right? Anybody even look at those and see what they are? I want to say 21 is definitely one of them. Is it 2021? Okay, good. All right, so that's kind of where we are in the book. Pretty short chapters, I think. Fairly short. Zoom, y'all ready? Can you hear me? All right, good deal. So we have a lot of families. And you may or may not know some of these. Probably you may not know most of these. But non-fermenting gram-negative rod, that's our topic. Pseudomonas ACA, there at the top. Moraxella ACA, Xanthomonaceae, Burkholderia ACA is, yeah, Flavobacteriaceae, Neisseria ACA. So if you take the ACA, you know, got Neisseria, Flavobacter, Burkholder, Xanthomonas, Moraxella, and Pseudomonas. So if you went through that in intro, those names. So Pseudomonas ACA is Pseudomonas aeruginosa is our main one we're going to focus on today. So when we get to the clinical significance, we bring that one back, and it's our most isolated one of the group. So it's the one we have, guess what, downstairs today. So you get to see it live and in action today. We also have some other Pseudomonases, which is fluorescens and Butida group. The Moraxella ACA is Moraxella species. One of the ones I love. I call it Acintobacter baumannii. Other people will go different with the accento, and I just kind of like to go acento, but a lot of acenta. So you'll hear it different ways, but it's all the same. And then I just love baumannii because I used to listen to Baumannii Jones on ESPN. I don't know if you're a sports fan, you know who that is. Xanthomonas ACA, Stenotrophomonas maltophilia. And one of the things we're going to learn today is some of these have tweaked their names. And it's hard enough to keep up with these names, so it makes it confusing when we decide to tweak a name and change it. So it makes it harder. There's Burkholderia ACA, Burkholderia Cispacia. Yeah, and then Burkholderia Pseudomonas, Flavobacteriaceae, and that one gets Elizabeth Kingia, Meningoseptica. Neisseriaceae has the Ichinella cordons, and we're going to see that one today on some slides. Looks good. And Kingia, or Kingia. So those are our names. We'll focus on, we've got a list in your handout that puts them all together and gives you their biochemical and their things that are known for. But let's talk about the gram-negative non-fermenting. And the question the other day, was it in immunology? Yesterday you asked a question about fermentation versus metabolism. Right. And we said, well, we kind of answer it a little better today because what we're going to have to distinguish is that these are non-fermenters, which means they're not going to ferment. They're not going to use the source for energy if they're in an anaerobic environment. They cannot. So they're going to have oxygen. They have to have oxygen to metabolize the sugar that you would think about, but they're non-fermenters. That means without oxygen, they can't go. Okay, they're not going to survive in an anaerobic environment. Okay, so we have rods. We have Coccobacillus, which kind of look like rods. We also have cocci in this group. So when we say the gram-negative rods, we may be on a rod, we may be looking at different morphology. So keep that in mind that we're dealing with this. So the environment, they're everywhere. That's what ubiquitous means for those that don't know that word. Widespread environment organism, which they're usually found in the soil and water. They're very hardy, but they're outside. So you may not find these unless you're getting exposure to the environment, but the hospital setting is one of those exposures too. So we find them in any wet environment. So sinks, faucets, water baths, respiratory equipment, medications, soaps. We may contaminate sterile solutions, such as IV solutions. That would never be good, right? So these are those pesky organisms that find their way into something we thought was sterile, or we thought there shouldn't be any organisms growing in there. And I'll give you an example firsthand. One of my first cerebral spinal fluids I did was they said, hey, if you want to see that better, when you're doing, because cerebral spinal fluid's clear, it's hard to see things. They said, just put a drop of crystal violet in there and it'll kind of stain stuff, overstain, and you'll be able to pick stuff out under the microscope. Well, little did I know, when I put that drop of crystal violet on the cerebral spinal fluid, when I put it under the microscope, all I saw was gram-negative rods. Or for me, it was just rods everywhere. Like the whole slide was covered with rods. I mean, and it was bacteria for sure. So I'm like, oh my gosh, the spinal fluid, they're on the brink of death. They've got this bacteria, and they got this much bacteria in their spinal fluid. So anyway, to tell this is one of those traumatic stories, that's one of those, it was kind of like a career-altering kind of story. But you're in there and you're going, I'm the night tech, right? So I pick up the phone and I go, hey, I need to report cerebral spinal fluid full of bacteria. And they're like, oh, we're having medical staff. We just all come down and look. Well, here comes all the doctors and they're coming in the lab. Here comes the lab manager. Everybody looks at the scope, sees it. Oh my gosh, look, that's bad. So the attending doctor goes, I got to go write ampicillin or an antibiotic. I got to up it. We got to take care of this. So they go down there and write up. So I'm like, man, a hero. I mean, I impressed everybody. I found the cerebral spinal fluid full of bacteria. And then you don't really work that part up. You go ahead and you culture the real cerebral spinal fluid and you do cell counts on it and you put it in the micro incubator for overnight, all right? So I come back the next day and I go, how'd that spinal fluid look? And they go, it's not growing anything. Not growing anything. It was full. It was like, everybody saw it was full. Not growing anything. I said, really? I said, give it back to me. Let me look at it again. And I didn't stain it this time. Put it under the scope. And there was nothing there. Put a drop of stain on a slide by itself. And that stain was full of rods. So the source of all that was crystal violet stain off the shelf. You wouldn't think organisms could grow in crystal violet stain. You wouldn't think chemical, that anything would grow in there. Where would it get anything, right? Yes, that turned really, I was hero one day and go the next, because it was like, did you follow the procedure? And I said, yeah, I followed the procedure. Y'all told me to use that stain to see things better. And they're like, that's not in the procedure. The procedure does not call for you to stain the cerebral spinal fluid with crystal violet. Oh my gosh. Yeah. So we had to have an in-service. We had to have, like it was gone from, you are the worst tech we've had. And the doctor's like running it up like, oh, and I put them on all that antibiotic. Maybe their kidneys are going to start failing now because they got them so hyped up on antibiotics. That's unacceptable. I got one of those talks. So that being said, be careful as to how quick you may, yay, everybody come see what I found, to doing it the right way, right? So I tell that story so y'all don't ever fall for that again. But you want to be in there. You're like, oh, I can do this. So this hospital setting, that's why I brought that story to mind, which was respiratory equipment, IVs. We check our blood units. You're going to do that next semester and talk about that. If we see something white in the blood unit and we're supposed to check that, make sure it's not contaminated, we might want to tap that baby and check it if it's got a lot of white cloudiness in that red blood unit. Okay, so some things we need to be aware of. Control is difficult once these organisms get into wherever they're in. They thrive. And the thing is that some of our antimicrobial ammonia compounds do not take care of these. So they actually fight through what we think is taking care of the organism. They are opportunistic, which means if we get an immunosuppressed patient, we get a patient on antibiotics, we get a patient that's intubated, okay? So we definitely see that in ICUs. The intubation machines have to be cleaned. It's going to be difficult if everyone ever sets up for Pseudomonas. And then definitely with the others where we're knocking down our normal flora or immunosuppressing our patients. So here is the real confusing slide. The classification is constantly changing. And basically what you see is we're kind of going away from the Pseudomonas name for more than just Pseudomonas and fluorescence, right? So if we had one, putrefaciens is now Shewanella, putrefaciens, okay? Putrefaciens, I like that. Pseudomonas testosterone is now Commonas testosterone. And I'll just go ahead and tell you, I don't think I've ever ID'd anything named Shewanella or Commonas testosterone. Those names don't hit that I've had come through. Pseudomonas multifilia has changed its name to Xanthomonas multifilia. And now it's Stenotrophomonas multifilia. So yes, very, very confusing slide. But just know, the most important thing there is, if you see a change in the name and you're not familiar with it, look it up, because it may have changed in the nomenclature and you just didn't know it. Or you're working with a microtech that's gray and old that remembers when we used to call it that, right? And you're on the machine now with an updated software package that's giving you the 2020 ID, and we may have to find that. So.
Why do they constantly change?
Well, they'll reclassify them and say, well, that's not a true Pseudomonas. It doesn't have anything to do with the other Pseudomonases. So it's just a group classification. So if they decide that doesn't have the biochemical reactions or it doesn't react the same, okay, they'll change it, switch it, and put it in a different class or a different family. Okay. Nothing about it has changed. We didn't learn it. They just decided that it fits better somewhere else. So what I'm trying to say is you see they're moving them out of Pseudomonas, right? They're grouping there. Growth requirements, isolation, the same procedures for the other enterics or the enteric gram negatives, right? We say the enterics that we worked with for the last couple of weeks, and we're going to work with a couple today. But they do the same, we do the same. They're not fastidious, which means what? If I was fastidious, so I would be kind of selective. I'd be requiring some extra. I'd be picky, okay? If they're not fastidious, that means they're not picky. That means they'll grow on anything. Okay, they'll grow on nutrient tryptic soyography. So you should see Pseudomonas growing well today, okay, in the blood. Moraxella, Eikenella, and Kingella species are fastidious. That means they're picky. They're picky about requiring additional blood as an enrichment. So the additional blood. So if you had, and that's why we do blood augers. I mean, it just makes sense. Most everything loves blood, tryptic, so PSA. We got the blood in there, but not everything. So that's always a point of test questions, always looking for those that stick out from the norm. Even though they're gram-negative rods, non-fermenting gram-negative rods, they may or may not grow on McConkey. So we know our enterics are pretty good on growing on McConkey, but some of these non-fermenters may not grow well on McConkey. So when we got McConkey out today, first thing some of our, the other students helping me this morning noticed, well, that, they didn't grow well on McConkey. That's what it's supposed to not do, right? It's not supposed to grow well on McConkey today. we'll see that. Oxygen requirement, these organisms are obligate aerobes, meaning what? They got to have an aerobic atmosphere. Okay? Little or no growth if they're in an anaerobic environment. So one of the things we learned today, we set up a Pseudomonas today for our research projects coming up for a couple of students. And the question came, should I loosen the top? We had a brain heart infusion liquid media. All right, and would you want to loosen the top on that if you're putting it in the incubator? If it says it's an obligate aerobe, we had Pseudomonas, okay? Yay, right? So that was a good catch on their part to loosen that top because they definitely don't want to put it in an anaerobic environment or it may not grow well. Biochemical tests are routinely incubated at our normal 35, 37 degrees Celsius. Pseudomonas fluorescens, putida, right? The group, they grow optimally a little cooler, so 30 degrees Celsius, and they may not grow at 35 or above, okay? So if we had Pseudomonas fluorescens or putida, we may not get them to grow off our 37 degree incubation. Many non-fermenting gram-negative rods are slow growing, and we got to extend the time to get the mature colony. And that's common for some other organisms we've already touched on, which is extend their time of incubation so they can get the growth up. So you can see it, use it, and as long as we don't have to do it McFarland 4 or 5, right? McFarland 4, we're pretty good, right? We don't have to swipe it all off. And it's hard for me to strep. They want us to go as high as we can go, right? But then we have API for one that grows well, like we got this week. All of our gram negatives grow all over the plate. They're like, oh, just pick one single colony, right? So anyway, we'll see a difference when we switch over to the microscan. Colony morphology, we'll see pictures today. Blood agar plates are used to determine the colony morphology, hemolysis, and pigmentation. So these are going to throw a pigment at you, especially Pseudomonas. Okay, it's going to have a certain name, and we're going to need to know that name and remember that name. And it's real fun to see on the plate because it's fashionable. It's one that instead of just being a little colony by itself, it likes to like put a thin layer of green sheen all over the blood agar plate. It's really neat. Like Proteus is stinky and it swarms everywhere, but Pseudomonas is going to nicely lay down almost like a clear coat over the blood. Makes it real pretty. Most species of non-fermenting gram-negative rods produce a smooth, raised colony. We're going to see that. So here is our Buckholderia. So who wants to take that? Is that we want to say C? Pick up. So how we going to go? Sep? How y'all want to say that one? Here's my English pronunciator here. We go C spacia, or are we going to go Sepacia or Sepaxia? Help me, somebody. I know I got some really good English students in here. No?
It's not English though.
Huh?
It's not English though.
This is not English?
Isn't it like Latin or something?
Is it Latin? You're good. Well, if you're good at Latin, let's take a shot. Go ahead. Anybody? Latin? How would you say it in Latin? Oh, you didn't take Latin. Anybody take Latin? No? Y'all no help? Who want? Okay, I'll do my best then. I think I got the Buckholderia right. I think I'll go there. I'll go with C spacia. I like that. I like the P. That way I know how to spell it. I won't forget the C. Hey, Sepacia? What do you say? Sepacia? Yeah, somebody from Zoom help me. Sepacia?
Sounds good.
Sounds good. All right. Thanks, Lauren. All right. I can do this one. I can do Pseudomonas aeruginosa. And that one was always a hard one to spell because that, like the gray hair tell you, I used to have to write this down on micro reports. I had to spell it out. couldn't put P aeruginosa, I had to put Pseudomonas aeruginosa. So it gets you, when you write out reports back in the day, instead of having computers do it for you, you learn how to spell these. It produces that flat, wrinkled, fashionable spreading colony. If you hold the plate at a right angle, you appear to have a metallic sheen. All right, we just talked about that, especially where growth is heavy. We're definitely going to see that today. So it's one of those that you don't miss very often if you see it on your plate. Here it is, and this doesn't do it justice. You know, it's kind of, you can kind of see a little sheen going. We've got it downstairs to make it do its justice, though. So you'll see it down there. A gram-negative rod, which is isolated on blood agar plate but fails to grow on McConkey, is a very likely non-fermenting gram-negative rod. So if you want to see that it doesn't grow well on McConkey, then you're probably, and that's going to be what? If it doesn't grow well on McConkey, what do you have? We have a problem, right? That's our plate that's going to help us differentiate gram-positive and gram-negatives, right? Yes. I hope you picked that up. Yes. So that's a problem for us. We can do an oxidase reaction, but it may be positive or negative. So it's not a telltale. You have your little guide, right? Everybody have their guide still that they're working with, their little flow chart. I brought mine. Yeah. Love this flow chart. So we're at gram negatives. We're at rods, right? We're at the non-fermenting. We see that. We see we've got oxidase positive. So far we got Pseudomonas over there, aeruginosa. We got Buckholderia. We got Vibrio, Aeromonas, and Plesiomonas, right? We've already touched on those. Do we see, we haven't got to our others yet. I see there's Stenotrophomonas. Multifilia is over here on the oxidase negative side. And we have Acintobacter bumani on the oxidase negative side. Okay, so our gram negatives there, we do have an oxidase differential that we will practice on with today. They're motile organisms. They may be differentiated on the basis of the number of arrangement of their flagella. We get back to triple sugar iron agar, or TSI agar reactions. We have fermentation. If they can ferment, they use the Embig-Enden-Meyerhof pathway. You know, y'all had that before. Should have been an intro. And produce large amounts of acid from the carbohydrate degradation. That's the fermentative organisms. We know these as non-fermentative organisms. They use the Embig-Enden-Meyerhof pathway, not the Embig-Enden-Meyerhof pathway. And there is little acid produced in the non-fermenting organisms in the TSI. The degradation of peptones produces an alkaline byproduct, neutralizes a small amount of acid produced. So that being said, that's kind of. We also have Hugh Leifson, oxidative fermentation media. We can use that. Contains less peptones, so a small amount of acid produced can be detected. So guess what? Where would you ever see Hugh Leifson oxidative fermentative media? Anybody want to guess? On a board question. That's just the kind of, I'm just telling you from, this is the kind of question that somebody writing a board review question would go to. They will go to these things because they like to take honor in the fact that if somebody like 80% of the graduates missed this on the board because they brought up Hugh Leifson oxidative fermentative media in a question about gram-negative rods non-fermenting, okay? So keep that in mind. Motility media, we can use it. Contains less agar, so we can see the motility of a non-fermenting gram-negative. It's not as vigorous. We do fluorescent medium. So if we have fluorescent medium, we see Pseudomonas, right? Aeruginosa and fluorescence putida. We can detect a water-soluble yellow pigment that fluoresces under UV light. Okay, I've yet to be somewhere where we have fluorescent medium. But this is the key. This is the one you got to remember is down here, the piocyanin medium, because Pseudomonas aeruginosa, right, has to detect the water-soluble blue pigment of piocyanin from the Pseudomonas aeruginosa that it produces. We actually can get a medium to use that to our advantage to see that blue pigmentation a little better. Blood agar does its job, but you can enhance that with a different kind of medium that's looking for that piocyanin that this organism has. We can also do denitrification, the nitrite test, where we detect the reduction of, what's NO3 again? Nitrate to nitrite. Reduction of nitrogen gas detected by use of Durham tubes. We could do that. That's old school. We can also use molars, medium, for enteric gram negatives, or gram negative rods, and non-fermenting gram negatives, or gram negative rods. That's the negative. But with the non-fermenting gram negatives, there's a delayed reaction up to 6 days. So we don't see a rapid medium, low initial pH. Okay, these are all testing tools to help us differentiate. This would be Proteus vulgaris versus Serratia marcescens. Lysine debarcoded, I'm okay with that. Gelatin hydrolysis, we see that. We have that on our API strip, right? We've seen gelatin hydrolysis before. Detects the production of protease enzymes which degrade gelatin, liquefaction. And we you know, when was it, last Thursday, we had some that turned totally black and some had a black string in it. The black string was a negative and had to be totally black to be positive. Cetramide tolerance, test ability for an organism to grow in the presence of cetramide, which is an inhibitory compound. Acetymide, utilization, deaminization, growth at 42 degrees Celsius, be a deterrent. Other useful DNase production, we see that on indole, we see that definitely. Urease, all these are on our test strips we'll be using today. All right, and I know that's kind of like, well, that's really got all those tests, right? Do y'all have anything in your handout that helps you with that? Y'all have a graph, a set of stuff in this one? I don't know if this one does or not. I thought it did. Maybe on the back. No. I thought I saw one. Was it in the? Is it in the PowerPoints coming up? Where did I see it? I was thumbing through and I thought I saw all of it together. Yeah, it's on the slide coming up. Hang in there. All right, we're gonna get to it. I guess we are. We missed this slide already. Okay, we ain't got there yet. Okay, it says Pseudomonas aeruginosa. It's got oxidation, glucose, xylose, maltose, ornithine, lysine, arginine. It doesn't have all that other stuff. It's got some of our stuff there. I knew I'd seen it. I just thought it was going to be here before we got to this. So Pseudomonas aeruginosa, the most frequently isolated non-fermenting gram-negative rod. Okay, that's good to know about Pseudomonas. Need to be able to put that together with that organism's name. Your handout from your flow chart says Pseudomonas is an aerobe. I think we got that already. It's beta hemolytic. Uh-oh. Yeah, we got another beta hemolytic organism that's not Streptogenes or Staph aureus. Blue-green pigment, but it does have a fruity smell. I go fruity. Grapes, maybe it kind of smells like, you know, maybe you just opened a thing of vitamins, or you've got some cough medicine you opened up, maybe just a little, you know, that kind of smell. I have never put it associated with tortilla chips. So that's your goal today. When we go to lab today, let's see what you think. We're going to have it growing on a plate. You're going to open it up. You're going to tell me if it's tortilla chips or if it's fruity grapey smell. Okay? We'll see. We'll take a poll each section of lab and see which one we go with. I've had people go tortilla chips though. I just don't get that one. So anyway, most strains are beta hemolytic. You'll see that on the blood agar for sure. Most strains produce a water-soluble pigment, giving it a green, blue, brown color. I go green, blue. I never go brown. The morphology, which you'll do on your gram stain. If you gram stain Pseudomonas today, it'll be long, thin, gram-negative rods. There's the sheen if you're looking for that. I think mine looks better downstairs already. Go with that. Ooh, that looks like hectoin. We're going to have that too. We'll see. I didn't. All right, where'd I go? Oops. Oops. Which way am I going? There we go. Okay. All right, those are my conkeys. Okay, what you will notice is that the swarming kind of disappears. It is a non-fermenter, so we don't have to worry about it being a lactose fermenter. All right, it is glucose oxidation is positive, which means it will ferment. It will oxidate. Sorry, let me start back again. Glucose oxidation is positive, meaning in the presence of oxygen, it can use glucose. It's not a glucose fermenter, which means in the presence of no oxygen, it will not ferment the glucose. So if you were doing the triple sugar iron agar, right? If we want to think about that, this would be the one, that would oxidize glucose on the slant, but not in the butt, okay, of that tube. It will not change it down there with no oxygen. Nitrite reducer is positive. Oxidase is positive. So we will do that today with our oxidase test. All Pseudomonas species are oxidase positive, and that might be where we lose some of those other members of this family, right? So those are the kind of things that can take you out of the class of Pseudomonas. Pseudomonas aeruginosa grows well at 42 degrees Celsius, meaning if we bumped up our incubator up to 42, we're looking for somebody else. Do y'all remember? Y'all remember who likes 42? Increase heat. Was it lecture before now? Seeing how well you're keeping up. Was 42 mentioned before now? For who?
Last lecture.
Last lecture.
Yeah.
Last lecture, but yeah, that's last lecture. So who was that organism we'd have to bump up to 42 to get to grow? Grow best at 42. Anybody? Allie, you looking for me?
Yeah.
Yeah. Thank you. Zoomland, y'all can look too.
This C. coli and C. June.
Okay. The C would be what? Citrobacter. Yay. Okay, we're doing well. All right. Okay. Is that on here? On my citros. Not really. I had it over here. Okay. Didn't make our list over here. All right. Gelatin test. Most strains are proteolytic, so we can put it on gelatin and it will break it down. Arginine, positive. Amino acid arginine for Pseudomonas, positive. Motility, positive. Cetramide, positive. Citamide and citrate, positive. So we got a lot of positives with Pseudomonas to remember. It should be on our chart. The other non-fermenting gram-negative rod is Pseudomonas fluorescens putida. Its fluorescence is positive, grows at 42. Its piocyanin is negative. So if we thought we had a Pseudomonas fluorescens and we saw the piocin, the color, it shouldn't be there. this one. And then we have Stenotrophomonas, maltophilia, oxidase negative. Glucose and maltose oxidizer, meaning it can use maltose in the presence of oxygen. Lysine positive, and there is fluorescence growing without the color pigmentation. There it is on McConkey. This is Stenotrophomonas maltophilia on a gram stain, big gram-negative rods. There it is on blood agar. McConkey. We have Buckholderia. We're going with Cepacia, Cepacia. Let's go Cep. I like Cep. Cepacia. Or what? I can't really say A. Can we say ace without the E in there? Really need somebody to step forward with pronunciations. Always look for somebody that can help me out, keep me straight. Y'all know Zach. Zach's your president for SALCP, Society of Student Society. He was my go-to. He was always willing to try it. Anybody willing to try pronunciation for me? Zoom, you can be in this too. Come on, somebody. It's not embarrassing. It's just to keep me from being embarrassed. I need help sometimes with some of I add E's and A's and I's a lot. So you got to keep me straight. Who wants to do that?
I'd say Cepacia.
Say it one more time.
Cepacia.
Cepacia. Right? Say it one more time.
Cepacia.
Cepacia. Like it. Okay. All right. So I've got my go-to now. Thank you. Grows on McConkey agar. Oxidase positive, lysine positive, ornithine. These are those amino acids that we got to kind of keep in mind. Ichinella corrodens. And we're going to go with that. Corrodens.
Sure.
Does not grow on McConkey. Okay, so here's one. That would be a distinction factor, right? So Ichinella, we may do what? We may gram stain, get into gram-negative rod. It's not on McConkey. How about that? It makes that gram stain a little more important, doesn't it? Oxidase positive, ornithine positive, lysine positive with the amino acids. But the thing about Ichinella, that's always a great question. It pits the agar. So it pits on the agar, which makes, kind of gives, hence the corrodens. And then it smells like bleach. Okay? Kind of one of those highlighted words. I mean, we have different names. We got the great fruity tortilla chip. Now we got smells like bleach for Ichinella. There it is. There's Buckholderia. Buckholderia again. Kate, good. What you got?
Cepacia.
Okay, good. Got Buckholderia again.
I told you. Now you can say.
No, I'm hearing. I got to hear it more than like over and over.
Cepacia.
C.
Cepacia.
Cepacia. I like it. All right, thank you.
Is it wrong?
No, I'm going. No, it's not wrong. I would never do that. No. I just butcher it sometimes. I just need somebody to keep me straight when it comes to some of these. Burkholderia pseudomali. Blood agar, a little different. So look at that. That's got a real distinct color, doesn't it? On blood agar. So we got a color there compared to the other, which is just a white, bright colony. Blood agar again. Gram-negative, Ichinella corrodens. Ooh. That's not good growth, right? That's kind of light. Why was it so light? Did it Did we get anything out of the description that made it light on that blood agar? Ooh, there it is. Look how light that is. It's almost impossible. But it's there. On chocolate, a little better pickup. So small. All right. All right, we're gonna go back to you, Cadence. You ready? Keep me straight. Do you like Bomani? 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 Go ahead and give me the first one now. You give me your pronunciation.
Of the A,
Yeah.
Acinetobacter, yeah.
A Cinetobacter? Cinetobacter? I like that. That's probably better than a Cinto. All right, a Cineto. I like that. A Cinetobacter, and you're going to go with
Bomani.
Bomani. All right.
Yeah.
Okay. It's probably spelled different than Bomani Jones, but it might not be. I'm not sure how he spells his first name. They are non-modal coccobacilli, so they're gram-negative rods, right? But they have the coccobacilla shape, which means they kind of look like Diplo sometimes, right? So we get an extended of the Diplo look, where they classify that as coccobacillus. Oxidase negative. Oxidizes glucose and xylose in the presence of oxygen. We have Moraxella species, oxidase positive, and not to just throw this at you here, but it is biochemically inert. Who else is biochemically inert? Shigella species, thank you. All right, so you connect those two dots in case you came across a Moraxella growing. So here is the Acinetobacter Bomani. And you see it does have the coccobacillus look right here. That's classic there. So you may look at that and go, that's Diplo, right? In fact, if I was gram negative, but I got gram positive, this is gram negative, but definitely not that typical rod, big rod, flat rod that we've been seeing. Acinetobacter Bomani on a blood agar, it looks like. Pretty. There it is on a McConkey, growing well. So biochemical identification, Pseudomonas aeruginosa grows at 42, produces fluorescence and hyoscyanin, the green pigment, and appears as long, thin, gram-negative rods on a gram stain. Here is what I was looking for earlier, where you see the oxidase. What we'll do, we've got one today, right? But if we had the, is that Moraxella there, the odораtum? We got Eikenella corridans with positive oxidase. And then we have the, what's S again? Who's that S? It's not Serratio. Who's that S? For the Maltophilia. That's good job, right? Oxidase negative. Acinetobacter Bomani is not oxidase. And then you see glucose, oxidizer, xylose for Pseudomonas, arginine. Then these are our amino acids here, ornithine, lysine. You see corridans right there. You see Maltophilia there. Okay, so that's definitely a differentiating chart. Helps to ID it. Your API would help you there. Your microscan would help you with those. Those would be in the wells. We go okay. I know that's rough, but we made it. We do okay. We get the highlights. We get the names. We get some of the reds, some of the important, some of the solos. Got an idea of what we're talking about now, hopefully? All right. That's the rough part. This is the easy part. Clinical significance is always easier for me to remember, to put down for what we have to worry about. The other stuff's harder to remember because it's such a lot of listed out stuff. So if you want to start, like, I don't know if y'all like note cards, if you like charts, if you like tables, you like Quizlets, you like listening to lecture over and over again, or you just all going to wait on the quiz? Which one are you going to do? You're going to hit that quiz hard on Thursday afternoon, aren't you? Yes, I hope so. All right. Because I got a ton of questions in this section. So, a lot
What
of
do you
questions.
think your pool is?
What's
What
that?
about, how much is your pool?
I don't know yet. I hadn't counted. I hadn't even started looking at it yet. But I know I got plenty.
What if you had a guesstimation?
I wouldn't even guess right now. Wouldn't even guess.
400, that's why it's open Thursday.
So Pseudomonas aeruginosa, major cause of nosocomial infection, so hospital-acquired infections. That's key for us. So if somebody comes down with Pseudomonas while they're in the hospital, that would be just a typical case of, hey, they probably picked it up from something we used here, whether it was in surgery, whether it was in just respiratory, right? Whether it was just a bag of IV fluid, whatever we may have introduced to the patient at the hospital level. Exogenous infections, if you got it outside the hospital, you would have had our source of organism as the environment. So it's reservoirs and contaminated IV, ophthalmic solutions, disinfectant solutions, hydrotherapy tanks. Ooh, yeah. Anybody jumped into a hot tub? Like, respiratory equipment and transfer from patient to patient by hands of hospital personnel. But you guys are so good about sanitizing your hands now, right? And putting on hand sanitizer and washing your hands when you come in from the grocery store and Walmart. Before you do anything else, you're washing your hands and washing your hands, right? So I hope that goes over when you start working in the hospital, that you wash your hands when you're moving from patient to patient. And if you see that not being done by others, just mention it. Say, hey, it'd be nice if you wash your hands before you went back in that room. Because we have to do what? Before gloves and after gloves. And a lot of people forget what? Before. They want to say that after was the before. Okay, so that's one of our glove pet peeves, before and after. Endogenous infections, the organism has colonized the host to become part of the microbiota, and we seen this before. I've seen every sputum culture I did on a gentleman was Pseudomonas aeruginosa, every time. It was part of his microbiota and his respiratory system. It ended up, I want to say it was one of the reasons he didn't do so well later in life, because it was just always there. So we see it in the respiratory tracts, we see it in gastrointestinal tracts. So that routine sputum that you set up in micro may be Pseudomonas, okay? That it's become part of their respiratory microbiota that they cough up with the sputum and you plate it out. 5 to 10% of healthy individuals may carry Pseudomonas aeruginosa in their GI tract, but that increases among hospitalized patients because of the selective pressure of the antibiotics. Infections occur from organisms carried in the respiratory tract and the GI tract of these individuals. So if it's in your GI tract and, you know, you're definitely could set up for UTs. See it there, urinary tracts. Infection with Pseudomonas rarely occurs in individuals whose immune system is not depressed. So conditions which predispose are immunosuppression, granulocytopenia. Y'all know that word, right? Histology, maybe? Not hematology, right? Hematology? What's granulocytopenia mean? Increase of white blood cells? What does it mean? The granulocytes or decrease? What's penia mean? Decrease. Makes sense, right? Y'all are all immunologists now. Burn patients, definitely. Antibiotic treated patients, intravenous drug users, respiratory disease, especially cystic fibrosis patients. Definitely one to be worried about.
This slide on this ground.
You don't have that on the student slideshow? I am so sorry.
I mean, it's fine.
Okay, the reason y'all want me to go back and print like with all the pictures just in black and white on your slide? Or y'all like this cut down version?
I don't mind not having the picture,
Yeah.
in my opinion.
But we're not getting all the slides either though. Okay. Or do you want me just to do better at checking to make sure all slides are there?
We have this information right here. We just didn't have it.
Oh, you have it on your study sheet?
Yeah.
Oh,
it's
good,
just
good,
the
good. Y'all just don't have a
slide, it's
PowerPoint. Okay,
I
I
was
got it.
looking to like fill it in, but it popped up. so
Okay,
don't worry about it.
good. Well, that probably means we're getting close to the end of the lecture, right?
Yes.
Okay. Well, let's talk about that other aeruginosa isolated from over 50% of the patients with cystic fibrosis. These isolates are encapsulated, meaning they have a virulence factor and they produce mucoid colonies. So what was the movie? There was a movie 5 feet away. Is that right? Is it 5 feet, 6 feet? What is it? Cystic fibrosis patients.
Oh, I know what you're
Oh,
talking
like
about.
that
the
6 feet
kids.
apart, or I think it was 6 feet.
6 feet apart,
or something.
right. Right, if two cystic fibrosis patients are in the same area, they have to socially distance. How far?
I think it's.
Is it 6?
might
Is
be
it just
5.
like
I think
COVID
that's the
distancing?
name of
I-
it.
Yeah.
Wow, wow. That's something where that came from, maybe. Huh. Yeah, but you don't, cystic fibrosis patient, they're susceptible, so they don't get close to each other because they may spread something to each other. That might be Pseudomonas, respiratory, right? Swimmer's ear. Everybody, otitis externa, right? Not interna, but externa, which would be 70% is caused by Pseudomonas aeruginosa. Occurs in healthy individuals. So if you've never had swimmer's ear, it's red irritated, all summer swimming. You get the water in your ear and you don't get it out, and it kind of sets up and kind of makes a painful external canal. Y'all have heard of swimmer's ear, right? Through the drops of alcohol, right? To evaporate that water out of there. Eye trauma may cause corneal ulcers, which may spread to other tissues, resulting in blindness. And urinary tract infections if the patient is on antibiotic therapy or catheterized. So this is where mainly ours are going to show up for the most part if we pick up a Pseudomonas. It's going to be a urinary tract infection. So we see pneumonia, cystic fibrosis patient, highest at risk. Septic shock, neutropenic patient. Urinary tract infection, catheterized patient. GI infection, premature infants, cancer patients, skin and soft tissue, burn victims, and wounds. And that's what we're doing downstairs, upstairs, and downstairs, upstairs. Mr. Bill Payne and Mr. Dr. Guffey have done a lot of research on this campus with Pseudomonas aeruginosa with burn. And now our group is with Dr. Motts with physical therapy, and we're doing a project with Pseudomonas aeruginosa. That's what our 410V class is. We have 2 students in that right now in micro, and they are working with me and Dr. Motts each week extra, okay, to get an hour or 2 hours of credit so they can work on a research project. So we're hoping to be at Creative State with their project, and we definitely hope to be published after we get through with it. So,
Are you saying it's for physical therapy?
yes, physical therapy does light therapy, like a blue light therapy. And so we're looking at wound healing with blue light therapy. So we want to measure, we're going to set up in vitro is what we're doing in a couple of weeks, where we will light up the Pseudomonas after it's growing and see if we can reduce it with a dose. And that's what Mr. Payne and Dr. Guffey had proven with the blue light therapy. They could reduce microorganism growth. So hoping if you get a burn patient, Pseudomonas is one of the deadliest things can happen. Set up septic shock, kill the burn patient is a Pseudomonas aeruginosa infection while they're in the burn unit. So that's just a little side note of where we're working on this. And maybe in the future, when y'all move into your clinical rotations, semesters and need some hours, you can come back and work with some projects on that we got going. Other Pseudomonas are environmental contaminants, opportunistic. We got Bacteria mallee, causative agent of equine infection called glanders. I don't know if we got any horse people in the room. We got horse people. Nobody's heard of glanders, but it can spread to people from the nasal secretions of horses. And we all like to kiss on our horses and let them sneeze on us if we think it's cute, right? But it could be not good for us. We have Bacteria pseudomallee, causes myeloidosis, aka Whitmore's disease. Again, if you see a name of a disease, circle it, because that name will come back to get you on a board test. When they want to associate Whitmore's, they'll put, what is Whitmore's disease, right? Multiple abscesses, they won't ask you what it is. They'll just say what organism and microbiology is associated with. And they'll list out Bacteria mallee and Bacteria pseudomallee. So it might be that one question that you, like, I remember that, right? Because that's the only time you're ever going to see it, okay? Acinetobacter and Moraxella and Eichonella, normal inhabitants of the skin or mucous membranes and are opportunistic. So anytime that skin gets broke down or our immune system breaks down, these three show up. Acinetobacter baumannii tops the list of World Health Organization's 12 drug-resistant bacteria that pose the greatest threat to humans. So Acinetobacter baumannii, drug-resistant bacteria worldwide in the top 12. Elizabeth Kingia meningoseptica is our neonatal sepsis organism. So baby with sepsis, it's Elizabeth Kingia meningoseptica. Do okay on that one?
Sure.
Sure? How would you have a different pronunciation?
Meningoseptica. Is that what you said?
I said meningo. How would you say? Meningo? Meningo? Okay. Good. All right. Thanks for playing. I'll keep relying on you, though. Believe me. Especially next semester if you're in parasitology.
You went around the whole class.
Huh?
I remember you going around the whole class.
Oh,
Everybody had to,
yes.
like, say 2 apiece or something.
Yes. Yeah. Yes. You'll never ever see me at graduation pronouncing names for graduates. No. You will never see me there. I don't know how they do it. It's a gift for me. No. I miss that class.
I think it did pronounce names wrong.
It was rough because one of them you couldn't hear, and she kept cutting in and out, getting low and loud, and you wouldn't hear half their name. The guy was doing really good. And I would have said, once I heard it, I would have given my card to the guy. I'm like, you're not doing a good job. I'm going to walk across the stage. Here you go. I've got wipes. We're going to end the meeting for Zoom. Ooh, we had a chat.